Welcome to Analysis. I'm John Rees. The deaths in this country during COVID were 3 times greater than all the civilian deaths in World War II. The official inquiry into the pandemic has just concluded that many of them died as a result of government carelessness, incompetence and a politically induced inability to come to terms with the scale of the health emergency. We have this report. Boris Johnson's Tory government did too little, too late, and as a result, 23,000 preventable deaths took place during the first wave of COVID, according to the official inquiry into the pandemic. This is what Baroness Heather Hallett, the retired judge who led the inquiry, had to say.
Also, the failure to lock down earlier may have cost lives. Had the lockdown been imposed 1 week earlier than the 23rd of March, the evidence suggests that the number of deaths in England alone in the first wave up until the 1st of July 2020 would have been reduced by 48%. That is approximately 23,000 fewer deaths.
The report describes the atmosphere in 10 Downing Street as toxic and government behaviour as irresponsible, a polite way of referring to the Partygate scandal and the multiple breaches of COVID guidelines by cabinet members and officials. The 23,000 figure for the COVID deaths refers only to the first wave of the disease. The report goes on to castigate the government for inadequate responses in the second and third wave of COVID pandemic. So the overall loss of life as a result of policy failure will exceed the 23,000 figure. The second wave alone, between December 2020 and February 2021, killed 65,000 people. One analysis concluded that 27,000 of those deaths might have been avoided or at least delayed had tougher action been taken. So the cumulative figure for the first and second wave is over 50,000 deaths. In the end, 220,000 people died during the UK COVID pandemic. At times, government simply ignored medical advice despite claims to be following the science. The Eat Out to Help Out push to get people back into cafes and restaurants was an obvious mistake, but it was relentlessly promoted by Boris Johnson and his then Chancellor, Rishi Sunak. Yet even now, the political right are attempting to undermine the inquiry findings. The Daily Telegraph called it a waste of money, and the Daily Mail headline chose to concentrate on the problems caused by lockdowns for school children, calling it a betrayal of our children. The relatives of those that lost their lives have vowed to hold the government to account for COVID response failures. So were these deaths simply down to government failure, or were there deeper problems? Will anyone that was in government be held responsible, and have the lessons been learned? Well, to discuss all this, I'm joined by Tarina Hine, author of A People's History of COVID, and by Alex Kenny, who's a former member of the executive of the National Education Union. Welcome to the programme, both of you. Tarina, has the inquiry done what it should have done? Has it pointed the finger at those that were guilty?
Well, it certainly pointed the finger at a number of people who were guilty. It clearly has named Boris Johnson, also Dominic Cummings, Matt Hancock, and the other person that has been highlighted is Chris Warmold, who is was at the time permanent secretary in the health department, and who is now the most senior civil servant in the country. And he was criticised for failing to rein in Matt Hancock, for not rectifying Matt Hancock's overly optimistic, completely unrealistic take on the pandemic. And yet he has been rewarded with this very significant promotion by the current Prime Minister, Keir Starmer. So yes, people have been named, but only as far as I'm aware has Dominic Cummings actually apologised. There has been nothing from any of the other sort of key people. And as I've just mentioned, one of them has been significantly promoted.
Do you think that the government, at what point could the government have done this differently? Did they simply not notice what was happening in Italy, which everybody else was watching on their television screens with increasing horror?
Well, yeah, they could have. They could have just switched on their television sets or listened to the radio like the rest of us were. It was incredibly remiss of them, to say the least, and basically criminal behaviour on their part. They claimed that they couldn't have foresaw what was happening, that there was nothing that they could do about it in advance, but that was clearly untrue. They could have put in movement restrictions. They could have instigated some sort of quarantine. They could have started working on some sort of test and trace system, as many other countries did. And instead, they chose to do absolutely nothing. And even before that, even before the pandemic hit, they failed in their very basic duty of care by not implementing recommendations of pandemic preparedness, which had been highlighted for the government. And so, no, there was plenty they could have done. So it was unquestionably reckless and quite possibly criminal.
Alex Kenny, you were a member of the National Education Union executive at the time. Schools were absolutely central to the COVID crisis. Many people would argue that it was the action of the NEU in pushing for school closures that obliged the government really to go into lockdown in the first place. So you must have seen how resistant the government were, and the inquiry makes this clear that they were resistant to the idea of a lockdown.
Yeah, right from the start, we could see that the government had no intention of closing schools at the beginning, and were forced into it by a combination of factors. We had started advocating for schools to be closed about 2 weeks before they eventually were. And we concur with the findings of the inquiry that if lockdown had happened earlier, if schools had been closed earlier, they might have been opened earlier, because we think that would have cut off the chain of transmission. We didn't celebrate schools being closed. Obviously, it's not a good thing for children for schools to be closed, but we could see, particularly in an area like where I was working in Town Hamlets, where a lot of families live in, a lot of households are multi-generational and overcrowded, we could see not that children were at risk, but the risk was that children would be spreading the infection. So we thought it was a necessity to close. And we were then proposing, we supported the key worker scheme, we supported staff going in on rotas, and we put forward a range of measures that the government could have put in place to mitigate the worst effects of the lockdown, such as Nightingale classrooms to take some children out of school when we returned. But they ignored them all.
Do you think that the government would have imposed a lockdown at all, or at least not imposed a lockdown until much later, had it not been for the stance of the union in the schools?
Yes, I do. And it wasn't just the NEU, it was all the education unions really together putting the case. And I guess the most extreme example of this is when we got to January 2021. If you recall, on the 4th of January, when the day before schools were due to open, Boris Johnson said that it was safe for all schools to reopen again, other than in some identified parts of the country. That night, we said to our members that they should effectively use health and safety to say that they wouldn't go into schools, because we could see what would happen if all schools reopened. And it was the next morning, Boris Johnson said all schools stay shut. So we do think it was the actions. And again, we don't celebrate it. We don't think it was a victory in the normal industrial sense. It was the right thing to do. But it was our actions and our pressure that forced Boris Johnson to instigate the second lockdown, which I think was crucial in January 21.
Tarina, within this overall story of incompetence, there are some specific moments which people will remember as kind of failures in and of themselves, with inside the larger failure. I've talked a little bit about the Eat Out to Help Out scheme, but then I think you referred earlier to the Test and Trace project, which never came to fruition. There was a whole crisis around the supply of PPE. There were the Nightingale hospitals, which were all opened up but didn't have sufficient staff, and so never really treated any numbers of COVID patients. There seems to have been, within the overall catastrophe, a series of sub-catastrophes.
Yeah, that's right. I mean, I think one thing we should try and remember when we look back at this time was something that happened very early on, and that was when Boris Johnson gave a speech in which he claimed that he was going to go around shaking hands with COVID patients, and in which he said that we needed to develop a herd immunity policy. And although the government of the day very much denied that they were pursuing a herd immunity policy after the first few months, I guess, the early stage. To my mind, it is pretty much what they did throughout, even though it was very, very clear from an early stage that that would result in hundreds and hundreds of thousands of excess deaths. But I do think that that's what they were thinking. They were totally prioritizing what they thought would be the prioritization of the economy over the health of the general public. And they rather stupidly thought that the public would go along with that. But of course, the public didn't. The public took it upon themselves to stop going out and to stop circulating. And so we got the worst of both worlds. We got a virus that had spread very widely and a very damaged economy with an extended lockdown period. And I think one of the important things that this report makes clear is that the lockdowns could have been considerably shorter than they were had they come in at an earlier stage.
Alex Kenny, what do you think it tells us about the political culture of the country? Because when we look back on it, it does rather stand out as a stark polarization between the essential workers, who then millions of people were applauding on their doorsteps in a pretty unprecedented and unique show of public support, and at the same time, in Downing Street, multiple infractions of the COVID regulations and actual parties going on in breach of those regulations. What do you think that contrast tells us about the political culture of the country?
Well, I think it illustrates something we've been seeing over a number of years, and we're seeing now a complete alienation from the political elite and our rulers and the mass of people. As Tarina says, people were taking their own actions and could see what was happening, and the failure of the government to engage with people who we weren't experts in the science, but we thought we could follow the science and see that schools were vectors of transmission and that something needed to be done. And we saw some, excerpts of WhatsApp messages between government ministers and civil servants that were just appalling in the way they were talking about people who really wanted the best for young people and wanted the best for the communities that we were serving. Their failure to engage, you can see right across politics, the failure of that government in particular to engage with the people who were working in the field, other than a very easy to do clap for the NHS, but don't reward the NHS, don't treat the people who work in the NHS with any seriousness, or don't treat them as though they've got anything to offer to a debate about the best running of the NHS. And I think we saw that in education as well.
Tarina, well, what do you think about this, the light that it shines on the kind of political profile of the country? I mean, the clap for carers was adopted by the government, but it didn't originate with the government. That was a grassroots thing that grew spontaneously. Meanwhile, at the top of government, there's this sort of complete complacency at one level and a very strong sense that the rules are for the little people, not for us.
Mm.
Well, I mean, I think that, you could sum it up by saying, well, we clapped, they partied. I mean, they clearly had no interest in rewarding the people who were on the front line. In fact, in this country, more health workers died than in any other country in Europe as a result of the pandemic. And that's a terrible, terrible statistic. These people were treated unbelievably badly with the PPE scandal, much of which could have been prevented. And yet, at the same time, they were partying. I mean, at the very beginning, Boris Johnson wasn't in Downing Street. He didn't attend any of the Cobra meetings. He wasn't even, according to this report, taking briefings about the virus, which is just astonishing. And then we later learned, of course, that they were holding all these extravagant parties a little bit later on. And so, yeah, I think it really tells us that they hold the British public in contempt. They have no interest in how ordinary people were faring during this period.
And Alex, what effect do you think it had on the working culture in this country? Because working from home obviously didn't start with COVID, but it does seem to have accelerated and not ever gone fully back. You can see this in the City of London. The working day, the working week seems to have shortened to be Tuesday to Thursday. It seemed to have broken a certain faith in the sort of Wolf of Wall Street, lunches for wimps. You've got to work yourself to death to get on. That people seem to have experienced sort of time out from that world and never been fully convinced they ought to go back to it.
I think that's right. I mean, obviously, in education, it's very difficult for people to work from home because they work in a site and they work with lots of young people. So, working from home is not an option for most people. But certainly, you can see the attraction of it. Sometimes I think you may lose something if you've got too many people working from home too often. That can lead to atomization, but I think it has broken that sort of culture, as you say, of get in early, leave late. It's the people who get in the earliest who get noticed, and the people who leave the latest who get noticed and are seen to be doing the hard work. So I think it, from what I can see, certainly, as I say, in my sector, it's not been so much of a thing, although schools have tried to explore the option of giving people, when they are not actually doing face-to-face teaching, the option of being at home. And I think that's been welcome. So I think it probably has broken that in early, leave late culture.
Tarina, will any lessons have been learned? Are we actually going to be better prepared for a similar or indeed perhaps even a repeat if a COVID variant develops that is significantly resistant to treatment?
Well, there were 19 recommendations in this report, and obviously we won't go through all of them. Some of them were definitely quite sensible, and so they include things like having some form of succession if the Prime Minister or leader or somebody in a very significant role in government is taken ill or died, as almost happened with Boris Johnson. Another is the creation of some sort of online tool which people can use to work out the restrictions that apply to them, rather than having this very confusing blanket restrictions that don't quite work in all circumstances. And that would obviously give people a little bit more control as well, which no doubt would be a good thing. I also think that one of the important things about this report, which, just to go back to something you said earlier, John, it has cost a lot of money and it is taking a long time. This isn't the end of it. But it is really an important tool, I think, in not just making recommendations for the future, but in holding public figures to account when things go so disastrously wrong. Now, we knew most of the things that have been brought out by this report, but it is incredibly important to have them stated in an official capacity in this way. And I do think that that may have an impact on how perhaps people behave in the future. And we can but hope that that is the case.
And Alex, I mean, one of the persistent problems and one of the things that weakened the NHS going into this crisis was underinvestment, schools suffering from the same thing. The Labour government doesn't seem to be prepared to depart in any significant way from Tory policy on this.
No, schools are chronically underfunded, and we've got data that shows that. One thing, certainly in the COVID, coming out of COVID, if I may, was we think there was a real betrayal of children not going into lockdown, but coming out of lockdown, where Kevin Collins was commissioned by the government to look at what was needed in terms of rehabilitation, mitigation against COVID. He came up with a very good report that required £15 billion being put in by the government, which we supported many of his proposals, most of them. And the government said, that's too much, we'll give you £1.5 billion. So a tenth of what he was offering, which was about £50 per child, you know, to coming out of COVID. So we are seeing the consequences still in schools. It has been a difficult journey out of COVID, and that still requires investment. That still requires investment. Schools need investment. If we're going to have another pandemic like this, it's important that schools are funded properly so that we can prepare for it. But what this Labour government is doing is continuing with Tory spending plans, imposing pay settlements on schools, but not the funding to follow it, and saying you have to find efficiency savings if you're going to pay your staff. So it is one of the things we're going to be looking closely at next week. What do this government say about education funding? Because we're pointing to a real shortfall in what schools need to deliver for the children we serve, particularly children with special educational needs and disabilities, who really struggled during COVID, have struggled coming out of it, and need key core investment in order for schools to be able to meet their needs.
Okay, well, I'm afraid that's all we've got time for, unfortunately. But my thanks there to Tarina Hine, the author of A People's History of COVID, and to Alex Kenny, who was formerly on the National Education Union Executive. And thanks to you for watching. Do tune in for future episodes of Analysis. But for now, good evening.